I'm so excited about the next presenter. This is a surprise that just was added today. She is, let me introduce her really quickly. I hope she's, so we're being joined today by Zainab Afridi. She is a 17-year-old. She's actually calling us from Pakistan, and she's been diagnosed with schizophrenia and bipolar. She's also an artist. She's been working towards spreading awareness about destigmatizing mental illness and how we shouldn't be ashamed of getting the treatment that we need and embracing it. So let me play a little part of her video.
And I'm an artist and I have schizophrenia. Right now, I am drawing a hallucination. A visual hallucination that I often have. Most of you won't know what schizophrenia is. It's a brain disorder that distorts the way that you perceive reality, act, and think. Its symptoms include hallucinations, delusions, false beliefs, disorganized thinking aids.
Welcome, Zainab. Thank you for joining us.
Thank you for having me.
So you're calling us from Pakistan right now. What part of Pakistan are you at?
Sindh, Hyderabad.
Okay. What's the situation in Pakistan about this whole virus? How are you guys dealing with it?
It's really bad. Yeah. People are not sitting in their houses. They just want to go out.
Oh, wow.
That just makes it worse.
Yeah, that's terrible. Thank you for volunteering to share your story. I know you were a surprise ad today, and I'm so excited that you're able to be with us. It's late over there right now. What time is it? Almost 11:30?
It's 11:38 p.m.
At night? Yeah.
Yeah.
So thank you for joining us. And I just wanted to ask some questions about what inspired. I just showed a little bit about your YouTube channel, about your sharing your story about having schizophrenia. We just had a conversation a couple of days ago about the huge stigma of mental illness within the Muslim community, and yet here you are in Pakistan sharing your story about schizophrenia and bipolar. Can you tell us a little bit about what inspired you to share your story?
I just said that mental health and mental illnesses are really stigmatized out here in Pakistan because brown people don't believe in such things mostly. And so not everybody wants to speak up about it. Most people have mental illnesses, but they never speak up. And so when my parents, they were supportive of me, they got me proper treatment and all that. But I saw people who were below me, who were lower than me, and they were not getting the right treatment. They didn't want to talk about it to anyone because they thought everyone is gonna tag them as a psycho or a crazy person, so they didn't want to talk about it. So I think that inspired me. That made me feel like I am really privileged to have people like that around me. That made me feel comfortable while talking about my experience and while talking about my disorders. And I thought that these last few months, I started to get real better. My medications started to suit me. So I started to get my mind in one place. So I realized that there are so many people who don't believe in mental health and how it's important to get help and right treatment. So there is so much awareness needed to destigmatize how we treat people. And so, yeah, that gave me inspiration on, okay, enough crying, Zainab. Now you have to stand up and do something for people who don't get the proper treatment and just don't have the same or similar opportunities as you. So that's what pushed me.
Wow. How old were you when you were diagnosed? You're so young. You're only 17 years old. How old were you when you were diagnosed?
I've had it since forever, but it was diagnosed when I was 14. I remember seeing things from since I was like 3 to 4 years old. And I used to tell mom, hey, look at that man who's just standing there. And she wouldn't see anything. And she would be like, oh my God, you're just a kid. You just make food, messing around, making fun. nobody believed in me. But when I got a little older, like 14, 13, it got real bad, and then I just couldn't sleep. I got so bad insomnia that I really needed pills to sleep every day. If I didn't get them, I would stay up straight a week.
Wow. So can you tell me what are some of the things that got bad for you that actually prompted you to go get help and for it to be a schizophrenia?
I started to hallucinate so much that I always thought that I was on some type of drug or something. And so I demotivation, no motivation to start with the day. No, I didn't have any routine. I didn't want to get out of my bed. I didn't want to take care of myself. I didn't want to do my hair, and no self hygiene. So that was really bad. And I started to stop my socializing. I had a very, very hard time socializing. I became an introvert, and I barely ever go on public. Still, I don't go on public. I never went on public for like a year, and I started to lose friends, and people were nervous. I was gonna be my friend, and how people talk about mental illness is that became a challenge. Many people said that maybe you're not close to God, maybe your sins have risen up so much that God is punishing you or something,
You're not
and
right.
you're not praying, and you're not close to God, maybe you're not a good Muslim.
So
Things like that.
Yeah, that's unfortunate that that's part of our culture. But can you speak a little bit about like a lot of people don't understand what schizophrenia is. You kind of mentioned it briefly in your YouTube video that the
But it was in Urdu, so most people wouldn't have understood it. So yeah, schizophrenia is a mental disorder, an illness in which you don't know what's reality, you don't know what's not. The image of reality and not real it's distorted in your brain. You don't know how to differentiate between that. You hear voices that don't even exist, and you might see some things or even feel. Hallucinations are tactile, auditory, and visual. So you can feel it, you can see it, you can hear it, and you hallucinate a lot. And also, schizophrenia is not always just hallucinating or seeing things. It's more than that. It's also societal tendencies. People want to kill themselves when they are schizophrenics, and this disorder, it makes you go crazy mostly. But that doesn't mean you're dangerous. Most people see schizophrenia as somebody who's dangerous. People think that if I have schizophrenia, I need to be in a straitjacket in a psychiatric ward in an asylum. But that's not it. Schizophrenia just distorts the way you think and perceive reality.
Wow. Yeah, I mean, it's people that don't understand it. It really helps to talk to somebody that actually experiences schizophrenia. And like you said, it doesn't mean you have to be in a psychiatric ward and in a straitjacket. You can still function. So when you were diagnosed at 14, you were given medication. How long did it take before you could, the hallucinations and the delusion stopped or reduced?
It took a really, really long time. I was diagnosed in like 2017, and still to this day, I still hallucinate a little bit, not that much, but these medicine that I'm taking right now, they finally suit me. My medications are changed every 2 or 3 months because they don't suit me, and finally these ones suit me, and I started them in this February 2020. So before that, no medications ever suited me, and they never stopped my hallucinations. They didn't stop the illusions and everything. And it's a part of schizophrenia that the medication won't just automatically in the first part, they won't suit you, but it'll take a little time, and when it and when it does, you'll finally start to feel better.
How has it been dealing with family members and people in Pakistan that find out that you have schizophrenia? How are they treating you? What's the perception of everyone around you?
My parents are really cool. I need to say that. My parents are very cool and very understanding and very supportive of me. So they always gave me attention, and they did listen to me. They always listened to me. And when I told them that I am seeing weird things and I'm hearing voices, they took me to a psychiatrist. But other people, like relatives and all, they said maybe she's possessed or something. Take him to someone, an exorcism, and that things. But they never believed in them. Society right here in Pakistan, they are so full of fake beliefs. They have no education, like a very little information about schizophrenia and mental illnesses. They think if you are behaving weird, if you hear something that other people don't, and if you see something that other people don't, you are possessed. You are just possessed, and there's nothing like mental illness. What are you talking about? There's nothing like mental illness. That's what we usually hear from people, but my parents are not like that. They supported me, and they took me to the doctor. I'm thankful for them for doing that.
That's amazing, because like you said, a lot of people in Pakistan and India, Afghanistan, all those, I have a website called Mental Health for Muslims. And so we get a lot of readers from Pakistan, Afghanistan, and India that read our articles. And I know that the mental health support is lacking over there in those countries. And so a lot of people don't have the support. So I'm so glad that you were able to see somebody. But I do want to mention about our religion and culture does believe in possession. We do, and it's not just Muslims, it's also Christians and Jews that believe in possessions. And I'm hoping to talk about that on Thursday with the religious leaders. But we do believe in jinn possessions. We do believe that that can happen, but at the same time, there's mental illness as well. So I think it's easy for people to just assume that mental illness is always possessions, but there can be a difference, right? And I'm glad that your doctor and your family were able to separate that and understand that schizophrenia is different. But even with treating possessions, I try and teach people that, yes, we do believe in that, and people do believe in possessions, but we should still treat it from a medical perspective first. Because the patient might believe in dark magic and possessions, but we should still treat the medical aspect of it. Do you have any thoughts about that?
Yeah, we shouldn't just say that you're possessed in the first place. If the medication is not working, so we can consider that. But a schizophrenic patient, they are already terrorized by the things they see and hear and the things they feel. And when somebody comes up to them and they tells them that, hey, you're possessed, there's a jinn living inside your body. So they are more terrorized, and that doesn't make them feel any better. That just makes it worse. So, yeah.
That's a really good point. And for people that don't understand what jinns are, it's like the equivalent of that would be a genie in the American culture. But jinns are in Islam and the Quran, they're mentioned that God has created jinns and that they're spirit beings that have the ability to go into a person's body and do possess them. So because we've had, like, even there's stories in the prophetic stories that we have, people do believe in that exists, but we also know scientifically and medically that mental illness exists. And for a lot of people that don't understand mental illness, it's very easy to just assume that it's a possession. And like I said, this isn't just Muslims that believe in possessions. I know there's a movie, The Exorcist, that's about the Catholic priests trying to get the demons out of the body. So it's not just Muslims that believe this. Christians and Jews also believe in possessions. But like you said, if somebody's already struggling with mental illness or schizophrenia and they're already terrorized and terrified by the hallucinations, they don't want to know that there's yet another thing that's inside of them, right, that's possessing and controlling them. I know that it must be really difficult for you, but how are you using your diagnosis and your illness to educate people now about destigmatizing mental illness and to just let them know that, yeah, schizophrenia can exist and I can still have a normal life? How are you using that through your art and your YouTube channel?
I tried to get my life in track. I started doing things that made me feel better. I started painting and I write songs, and I started to learn guitar and doing such things. Art in any form, it makes me feel better. And when I do it, I can show it to people that, see, I have schizophrenia and I am living a normal life, and I can talk to you like a normal person, and I can paint and I can make music like a normal person. So just don't stigmatize us as crazy patients. We can also have normal, fulfilling lives. Most people always think that schizophrenics cannot lead a full life. They think that we are always patients. We always need to be in a hospital, but that's not it. We get a treatment. Some people get their shots monthly or yearly. Some people take their pills daily. Doses depend on the severity of it, but we can surely have normal lives. We can live normal lives. Like I started my YouTube last week, and I made a video about it. How we should not stigmatize it. How we should understand it. Oh my God, my throat is so dry.
I know schizophrenics, that people have been diagnosed with schizophrenia. They have had it. They've got married. They have had kids. Is there a fear or a worry for you as far as moving forward? Like I said, you're so young. Your future is ahead of you. So do you ever think about that, or your family? Given that you're in Pakistan, is that a concern for you regarding getting married and having kids moving forward?
Yeah, people around me, they do pressurize me to just stop doing such things. Nobody's gonna marry you if they get to know that you're crazy or that you're mad. Getting married and starting a family, that's least of my concerns.
You're not even focused on that right now, right? You're so young. Yeah. Okay. What would you say to people that have like family members that have a child that has been diagnosed with whether bipolar or schizophrenia or even depression or anxiety, or they might even be suicidal? What are some suggestions you'd make for them?
You know, when children and young people or even old people, when do they think about suicide and hurting themselves? They start to think about self-harm when there's nobody to talk about that. So please talk to your children, talk to your siblings, and whoever that is going through a mental illness, just talk to them and just tell them that you're there for them and they're not a burden. Make them feel good. Help them find hobbies and help them in any way possible, and don't make them feel low. Don't make them feel like they are any different from other people, and don't make them feel like having an illness can stop them from living a good life. And so people who know people who have schizophrenia or any other mental illness, I would suggest them to just treat them like normal people and talk to them more often and show them that you care. Just talk to them.
And just normalize the whole idea that just because somebody has an illness doesn't mean that they're not worthy of being talked to or treated and cared for, right?
Yeah. Help them accept it and embrace it, that they do have an illness. Like, they do have an illness. And just tell them that it's normal. humans can malfunction sometimes, and that's normal. Don't make them feel bad about it.
I love that you said that humans can malfunction sometimes. We all have a head on our heads, on our bodies, and our brain can malfunction. And that there is help out there. That's the whole thing, that there is help out there, and go get help, and don't feel that it's a lost cause or suffer needlessly, because there's so much help out there. You don't need to suffer needlessly. And so go where you need to get that help. One of the Facebook users is asking, when and how did you realize that you have this illness?
So I've always had this illness, and I always talked about it, that I see weird things and I hear weird voices, but nobody believed in me. But then it got really bad when I turned 14, and I had insomnia, so I just couldn't sleep. And I didn't sleep for like a week straight, and that made things very terrible for me. And I started to throw fits, and my parents were really concerned for me. I heard voices and I talked to them, and I saw things, and I started to get scared of them. I tell my mom that, Mom, please save me. He's standing there. He's coming for me. And I hear voices. And so my parents helped me, and they took me to the doctor, psychiatrist, and they helped me. It was 3 years ago.
I am so impressed by the proactiveness of your parents. So I'm so glad that you had parents like that helped you understand it. And for being 17, you're so mature and so wise beyond your years. I'm very impressed with your ability to communicate this and use your voice and use your experience to educate the community, either whether it's Pakistan or the whole rest of the world, educating them, because we need more people with mental illness to stand up and say, yes, I struggle with this, and this is how you can, I'm living a normal life. These are my coping strategies. These are the things that have helped me. I think that's how we can end the stigma, by just talking about it and not being ashamed of it.
Exactly. That's why I made that video on YouTube. First, my parents were like, if you want to help people, go help them in any way possible, but don't do that thing where you say that I have it, I have schizophrenia, I know what it feels like. Because people think that you are crazy, because people out there are just like that. We do believe in you, but other people won't. So I said, Mom, that's what I want to do. I want to normalize it. If not me, then who? Because I know what it feels like, and if I'm going to step up, if I'm going to take the first step, many people are going to follow me.
Thank you. Wow. If not you, then who? Beautifully said. Thank you so much. We have a comment here. It says, I'm glad that you got help and you're open to your parents. I congratulate you on finding healing. That's so amazing. Your story is beautiful. I will share your YouTube link on the Facebook page. My goal also is to destigmatize mental illness and to talk about it and reduce the shame and get rid of the stigma, so that we're all talking about it like as if we had a cold. Like we're not ashamed of having a cold. We're not ashamed of having the flu. But if we have anxiety or depression or schizophrenia, we hide and we're embarrassed to talk about it. And I hope that we're not embarrassed to talk about it and to reduce that stigma. Somebody said that you are so brave and beautiful. God bless you. And that's
really? Am I beautiful?
Yes, you're beautiful and brave. So
yeah, I am brave.
Yes.
Thank you.
Keep doing what you're doing. Your future is very bright, and I hope you continue to use your voice to educate the community, the country, and the world about overcoming mental illness. Let's see if we have, oh, here's another comment. We need more youth to talk about these mental illness issues. Yes, so true. So you're doing a wonderful thing. Keep it up. Oh, more comments are coming up.
Thank you.
Yes, you are. You are. So thank you, everybody, for your comments. And I will post her video on the Facebook page. So go ahead and follow her and share her video. And let's get you 1 million likes, okay?
Oh, thank you. That would be great.
Okay. Well, thank you so much for joining us and being here. I am so proud to know you, and I'm so glad that you were brought to my attention this morning. And thank you for joining us and sharing your story.
Thank you for having me here. It's an honor to be here right now. I never thought I'm gonna be somewhere like this.
Well, here you are, all the way across the world. So thank you, and you have a good night. I know it's late, so I want you to go to bed on time.
I don't sleep. I sleep after the seher.
Okay. All right. Take care.
Take care.
Bye-bye.
Bye.
Wow, that was so powerful. She's amazing for sharing her story, and I'm so glad that she came on. And I actually wanted somebody to share their story. I couldn't find anybody willing, and God brought her into our lives, and here she was. She shared her story, and it was very powerful.